Well, we will go ahead and transition to our next speaker. In serving the theme of EHR, our next speaker is also going to be giving a presentation centering around that. So, Dr. Carly Sorensen is a third-year internal medicine resident at the University of Iowa. She's currently a member of the Distinction in Medical Education track, which is a program designed for residents who plan to include medical education as part of their professional career. Her projects, entitled Duties at the End of Life, focus on teaching fourth-year medical students skills used by physicians when caring for patients nearing death. Dr. Sorensen is looking forward to continuing opportunities to incorporate medical student education in her future career as a hospitalist. And her talk is titled here, Utilizing a Simulated Electronic Medical Record to Teach Complex Medical Decision Making at the End of Life to fourth-year medical students. Dr. Sorensen, go ahead and take it away.
All right. Thank you all for having me. I'm really excited to kind of share my project with you all. Let's see. So I first want to just start acknowledging my mentors, Dr. Daniel Miller, Dr. Jenny Strauss, and Dr. Matt Soltis. Thank you for all of your help and input on this project. Our objectives today are to demonstrate how to utilize the electronic medical record as a tool to teach medical decision making, as well as propose future opportunities for the use of simulated patient charts in teaching settings. So to give a little bit of context, I'm just going to briefly kind of talk about my whole project. It was an afternoon session during our TTR course that focused on duties that physicians face at the end of life. And those include things like the death pronouncement exam, delivering difficult news, talking about I-posts, and then talking about comfort care focused plans. We had 23 students participate in this session. We started with a large group didactic session that kind of briefly introduced these topics, and then we later split into small groups, focusing on each different topic for 20 minutes, and the students would rotate through all of those. This was the session's third year, so based on prior feedback, we did add a news station. Students really had emphasized that they wanted to have more active participation over peer observation, and then separately had frequently been asking for more interactions with the electronic medical record and specifically placing orders. So the goal of this comfort care case was to introduce them to what a comfort focused care plan might look like, while they could also go into an actual patient chart and add orders, discontinue orders, or modify things to reflect kind of that new plan. And so developing this station kind of boiled down to two different things. One, creating the comfort care didactic session and the teaching points, and then creating a simulated patient and epic playground that could coincide with this. And as far as creating the didactic session, I relied heavily on input from the palliative care team, particularly my mentor, Dr. Daniel Miller. Palliative care and comfort care is a really broad, expansive topic, so we had to boil down to kind of the main points that were also appropriate for the level of a fourth-year medical student and soon-to-be intern. So we landed on the main teaching topics of talking about different opioids and which agents you might use in certain scenarios, as well as the importance of deprescribing, particularly certain home meds, labs, vitals, things that aren't in line with comfort care, and then recognizing nonverbal signs of pain. And then we briefly touched on patient-controlled analgesia versus nurse-controlled analgesia and when both of those may be appropriate for your patient. So this is a screenshot of the facilitator script that I developed. We had an internal medicine resident and a palliative care pharmacist work with the students in this station. And so it went over the story of the case. The patient initially came in for a small bowel obstruction, later decides that they would like to transition to comfort care. And so this guided the facilitators on when to prompt students to change the orders and also help guide them on what to change, and then when to kind of pause and refer to the PowerPoint to talk about some of the teaching points. And this is an example of one of the slides from the teaching points talking about the opioids and when one agent might be more appropriate over the other. The second part of creating this was actually creating the patient chart. And so that involved meeting with the EPIC team. I actually just emailed the EPIC team at the University of Iowa, and they were able to direct me to their specific training request division. We met over Zoom, and at that time I had kind of a rough draft of the patient story and kind of what I was looking for. I had this list of orders and things in the chart that I had wanted, so I was able to send that to them. They had a kind of pre-made patient that fit some of the requirements that I was looking for, and then they were able to just kind of add some of the information that I had requested. And then we met several times kind of throughout the spring to review it and make any edits before the final version was ready in April for our course. And I do have just a video here to kind of show what the chart looked like. I wanted it to look just like the EPIC that we use every day. And so we had vital signs in there. There was some kind of basic notes, labs, and then the orders were kind of the most important part for me. I wanted it to be interactive so students could discontinue things, modify things. And then we were able to add orders as well. This does include all the order sets that we have at the University of Iowa. So kind of more specific to our institution, but I think it's still kind of relevant information that learners can take with them as they move on to intern year. And then we kind of concluded the session. We have an end of life order set here at the University of Iowa. So it kind of was like a conclusion and sort of summary of all the things that we had talked about. And so we looked at that together as well. So looking at outcomes, primarily our data was more subjective and student feedback was overwhelmingly positive. Students really enjoyed having the station. They felt like the information regarding comfort care and then as well kind of working in the EHR was very practical. They appreciated the more hands-on, engaging, interactive session. And these more simulation and hands-on sessions were frequently recommended to be continued by the students as well at their end of TTR survey. We did have one multiple choice question on the survey. This was included in the pre and post session survey from the TTR course. And so the question gave a patient scenario, and the goal was for the students to identify which opioid was most appropriate based on patient risk factors, and then as well as kind of recognize those nonverbal signs of pain, and that an NCA was most appropriate for that situation. And so we did find a statistically significant improvement of 23% with a p-value of 0.015 in the learners choosing the correct pain medication for the scenario. And just to touch on some of the challenges, I alluded to them a little bit, but palliative care, comfort care is a very broad topic. So making sure that we had an efficient and thorough kind of teaching session that we could fit into a pretty short amount of time was no small task. And we only had 20 minutes to kind of do a lot of that teaching as well as let the students practice with the orders. And then our objective data was a bit limited since this was a one station inside of a larger session and sort of a larger course, kind of limited how many things that we could add on the survey as well. And so looking forward to what's next. I will be leading this session again this spring. So I'm thinking about some of the changes that we'd like to make. The initial didactic session before the small group sessions, we didn't talk as much about comfort care. So I'd like to put a little bit more of that teaching in the didactic session so that when we get to the station, we can really just kind of focus on our team has been talking about is maybe replacing a different question to add a confidence level assessment with placing orders pre and post session. We'd also discussed kind of creating like an order rubric, so having a set listed change that we would recommend based on the teaching that we give the students, and then kind of comparing that to what the students place in Epic Playground. I did see in the comment section some people were mentioning that Epic Playground has some kind of grading and rubric style things, so that's something that I'll definitely be looking into as well. And then lastly, I just want to kind of touch on future implications, which I think is really the most exciting thing about this type of project. Simulated patients in Epic Playground can really be applied to a variety of scenarios, any specialty. I think it's easy to use this kind of model as a standalone session or add it to current sessions that maybe have a little bit more downtime to try to help students be more engaged. And some of the topics that either my current co-residents or past residents have done. There's currently one resident doing an admission order session. I think you could easily apply it to discharge orders as well. We've had a resident in the past talk about inbox management and practice that with students. I think you could apply it to note writing and, endless possibilities as far as care plans and commonly seen problems. So I encourage you all to think about adding this to your TTR sessions. Students seem to really enjoy it, and I think it's a great way to get some good clinical knowledge as well as kind of practical knowledge using the EHR. And that concludes my talk.
All right. Thank you so much, Dr. Sorensen. So far, we have one comment in the chat from Lauren, talking about this, seems like a big gap for student training and really, they can take away with really valuable and practical teaching points. Wondering if there are ways to incorporate micro assessment here.
I think I think definitely. That's definitely something that we'll have to look into a little bit more, but I agree.
Another comment just popped up to see if there's a way to share Epic patients across institutions. Um, Not sure if either speaker have any experience with that.
I don't personally know, but I'm happy to reach out to our Epic team and see kind of what insight they have.
Now, in thinking about the session that you have described, it's as you alluded to, it's such a multifaceted component. There's the communication part of it in terms of delivering the news. There's a technical component of pronouncing. There's certainly an professional collaborative aspect to it, and then there's also a knowledge and skill base when it comes to taking care of a patient. So. Um, you know, are there other sessions um, in your course that reinforces some of those concepts before the students get to this particular training, where this is more of a demonstration with what they have already learned, or are all those teachings sort of de novo within this particular session?
I think, this session is kind of their first real big experience actually getting to do this. I think in general, we sometimes shy away from teaching medical students these things because these can be uncomfortable, kind of difficult topics. And so oftentimes we kind of want to shield our medical students from that. So a lot of students give the feedback that they really haven't had a lot of experience with this. I think that's something that at our institution, we're trying to be a little bit more conscious of. But as far as in the TTR course, we don't really have anything preceding this to kind of prime them or set them up. This would be kind of their main exposure to these topics.
Yeah. Thank you. So it looks like there's a lot of enthusiasm about collaborating and potentially using TTR educators as a hub to collect and distribute these potential patients on Epic Playground. So we're excited to hear that. Okay. Any other questions from the audience? All right. Well, thank you so much, Dr. Sorensen.
Thank you.
Fantastic work, and thank you so much for sharing.